The season to be depressed. Seasonal rhythms are important. Sometimes winter depression alternates with summertime mania in certain disorders. Seasonal affective disorder, or SAD, is a depression putatively brought about by the short days of winter. It affects women predominantly, and a way to fix it is a method called light therapy or phototherapy. The reason this works could be a result of placebo effect, though. Scientists are still searching for animal models of depression. Learned helplessness is a learning paradigm in which individuals are subjected to inescapable, unpleasant conditions. It is linked to a decrease in serotonin and dopamine function and is similar to the depression. Removing olfactory bulb in rodents creates symptoms of depression. Symptoms decrease with antidepressants. Flinders sensitive line is a certain species of animals that are a proposed model of depression. There are several types of anxiety disorders. Panic disorders cause a higher mortality rate. Anxiety disorder is any class of a psychological disorder that includes recurrent panic attacks and generalized anxiety disorders. Phobic disorder is an intense irrational fear that becomes centered on a specific object, activity, or situation that a person feels compelled to avoid. Generalized anxiety disorder is a persistent and excessive anxiety and worry that are experienced for months. Panic disorder is a recurrent transient attack of intense fearfulness. It can be due to temporal lobe abnormalities. It is shown to have temporal lobe volume a lower amount, but however, hippocampal volumes remain normal. Drug treatment of anxiety provides clues to the mechanisms of this disorder. Benzodiazepines are a class of anti-anxiety drugs that bind with high affinity to receptor molecules in the central nervous system. An example of this would be diazepam. Anxiolytics are a class of substances that are used to combat anxiety. Examples are alcohol, opiates, barbiturates, and benzodiazepines. Anxiolytic benzodiazepines bind to GABA receptors and act as non-competitive agonists. Enhancement of GABA at inhibitory synapses. GABA-mediated postsynaptic inhibition is facilitated by benzodiazepines. The ultimate function of the benzodiazepine GABA receptor complex is to regulate the permeability of neuronal membranes to chloride ions. In post-traumatic stress disorder, horrible memories won't go away. Post-traumatic stress disorder, or PTSD, is a disorder in which memories of an unpleasant episode repeatedly plague the victim. Memories produce the same visceral arousal experienced during the fear. This includes fear, trembling, and general autonomic activation. Examples of events that cause this kind of disorder are death of a loved one, rape, torture, kidnapping, and social isolation. Familial factors affect vulnerability to PTSD symptoms. This is a major affliction seen in veterans. People who display this combat-related PTSD have strong memory changes such as amnesia for some war experiences. They experience flashbacks and also have deficits in short-term memory. Fear conditioning is a form of learning in which fear comes to be associated with a previously neutral stimulus. It is persistent and it involves the amygdala. PTSD may depend on the failure to forget. In obsessive-compulsive disorder, thoughts and acts keep repeating. Obsessive-compulsive disorder is a syndrome in which the affected individual engages in recurring repetitive acts that are carried out without rhyme, reason, or the ability to stop. Compulsions are acts that are repeated over and over again, and obsessions are recurrent thoughts that invade the conscious mind. They isolate people from a typical social environment, and it takes up a lot of time on the individual afflicted. OCD responds positively to CBT and several drugs. The drugs inhibit reuptake of serotonin at serotonergic synapses. Depression often accompanies OCD. Comorbid means the reference to the tendency of certain diseases or disorders to occur together in individuals. There is a heritable genetic component to OCD. Severely disabled OCD patients have received cingulotomy for relief. Cingulotomy is the surgical disruption of circuits in the cingulate cortex. Tics, twitches, and snorts, the unusual character of Tourette's syndrome. Tourette's syndrome is a heightened sensitivity to tactile, auditory, and visual stimuli that may be accompanied by the buildup of an urge to emit verbal or phonic tics. And it includes being super sensitive to tactile, auditory, and visual stimuli. It begins early in life and is more common in males. It also usually occurs with ADHD. Some people respond well to antipsychotics, psychotics for for Tourette syndromes, while others benefit from deep brain stimulation. The cutting edge. Abnormal eye movements might be an endophenotype for people at risk for schizophrenia. No inherited gene inevitably leads to the condition, but people with schizophrenia have difficulty with smooth pursuit eye movements, and this could have a large impact on the diagnosis of this disease.